Good day and welcome everyone, and thank you for joining this session. I hope this will help clarify some uncertainties and help you prepare for the new stage of work that has come on. Just want to ask that those of you make sure that you keep yourself muted, just to allow everyone to clearly hear, so that there's no distractions or disruptions in the presentation. I have been receiving quite a lot of questions, especially after yesterday's publishing of the new Disaster Management Act, which we have been waiting for, of course, in great anticipation. The answer to these specific questions will be included in a Q&A later when we share the presentation with you. And also we will be sharing the presentation and the PowerPoint with you by the end of today. Just a brief overview of what is COVID and how does COVID affect us all. Simply put, COVID is a virus that attacks the respiratory system. And those exposed to the virus can become ill and even die depending on the physical condition. It's primarily transferred from person to person through droplets that is spread through coughing, sneezing, and those who spit while they speak. As the droplets are heavier than air, it falls to the ground or onto surfaces, and thus by touching these contaminated surfaces and then your mouth, your eyes, or your nose, you can also become infected. The initial symptoms may include a fever, dry cough, shortness of breath, headaches, and difficulty breathing. And other symptoms can also include diarrhea and vomiting, and more severe stages includes pneumonia and other organ failures as the immune system is broken down. All people are susceptible to the virus, and is most reported cases mild. Up to 80% of all reported cases are mild cases. However, more severe cases include those with weaker immune systems, including people with heart disease, blood pressure problems, asthma, chronic bronchitis. The elderly and of course also the young are more susceptible to the severe outcome of these cases. Corona can be prevented through isolation, strict hygiene habits, social distancing, remote working practices, coughing and sneezing into your elbow or a tissue. So these are just very quickly and very brief aspects of COVID that you need to keep in mind and which you can easily share with your employees when you start communicating with them about this. Again, those of you who have not yet signed in, please click on the chat icon at the bottom of your screen and just complete your name and company details for me to just see who took part in today's presentation. A massive warning to everyone. This is a cry of from the heart. I really want to encourage you to not think that level 4 is an open invitation for the world to go about as they please. Level 4 is a major risk to the well-being of everyone. Opening the country to level 4 is putting everyone at risk, and is it our responsibility as management and employers to make sure that this doesn't turn into an Armageddon scenario. If we do not take care and we do not adhere to the strict measurements, we can end up back in level 5, lockdown with even more restrictions that can inhibit some of the essential services as well. So please don't take chances during level 4. Rather ask questions and clarify any uncertainties than to take chances and put yourself and other people at risk. Points of discussion today is the Health and Safety Directive that the Department of Labor has shared, focusing on Section 7 and 8 of the Occupational Health and Safety Act, as well as the employer's obligations, which will be linked in with the primary principles that I shared with everyone through email: risk assessments and control measures, policies, and training and information. So the directive shared focuses on various aspects of the Health and Safety Act, of which the first one is Section 7 of the Health and Safety Act, speaking of the responsibility of the employer to put in writing a policy concerning the protection of health and safety of his and her employees at work, including the descriptions and arrangements to protect the people. How are you going to carry it out? The focus within the directive is more on companies in excess of 500 employees. However, it is advised that even if you have less than 500 employees, do make sure you have a clear guideline in protecting your employees against the COVID virus. Section 8, of course, is one of the very familiar aspects of health and safety, stipulating that every employer shall provide and maintain, as far as reasonably practicable, a working environment that is safe and without risk to the health and safety of employees. This is again reiterated in Section 4 of the directive. As mentioned on various platforms and even by the President, all businesses must prepare a risk assessment to identify the hazards and risk employees and the public is exposed to regarding the transmission of the virus. And this is also very clearly stipulated in the directive under Section 16.1. The primary hazard is that workers face transmission by infected persons at work, whether a colleague or the public. Clients, the fact that you are stopping at a garage, petrol attendants, and so forth. The risk assessment must be accompanied by control measures that prevent, eliminate, and reduce the potential of transmission of the virus. Sector guidelines might refine and stipulate additional requirements to the directive. However, it may not pose a greater risk than what is stipulated in this particular directive. And as I discuss the primary principles, I will link it up to the elements within the employer's obligations under the Health and Safety Directive published by the Department of Employment and Labor. So conducting a risk assessment, there are 4 aspects that we will be looking into: identifying hazards and associated risks, the likelihood and severity of the risk, control measures, and the Department of Employment and Labor's Health and Safety Directive. So as mentioned, the primary hazard is that workers face potential transmission by interaction with infected persons. Infected persons may be people they share transport with, their colleagues, the public, and whether a client, a shop assistant, or a petrol attendant, and more. So there's quite a lot of people that when you go out of your house, you end up exposing yourself to, and this has a chain reaction. The associated risk is the persons exposed to the virus may become ill and even die, and there is additional risks including economic pressure, operational disruption, mental health concerns, and more. The following hazards should be assessed whilst you are busy with the risk assessment and completing that questionnaire that I supplied you with to help you consider various aspects. This includes what is the biological, physical, chemical, and economic hazards, and what are the psychosocial hazards. We're talking about depression, anxiety, distress, fatigue, discrimination, the list goes on. And you need to take various things into consideration when you're preparing for the new stages in work. On the list in front of you, I am sharing just a few considerations regarding the hazard. Elderly people, people with existing conditions, interacting with the public, poor hygiene, lack of hygiene facilities. If you think about employees coming out of rural areas that don't have fresh water to clean themselves with, not properly performing symptom screening, lack of social distancing. One of the things that frustrates me when I go to the shop is that the person behind me cannot keep their necessary distance. It puts me at risk, and it puts a lot of other people at risk, because the moment I get home, I interact with my family. Sharing of common areas like kitchens, canteens, bathrooms, stairways, smoking areas. Smoking policies are one of the things you will have to revise, and how are you going to manage that? Sharing and using of vehicles, plant, machinery, equipment, laptops, the kettle, the coffee machine, There's so many things that we all end up using during the day that might end up exposing ourselves to the risk. Likelihood and severity. When we're deciding on whether risk is high, medium, or low, we have to consider the risk rating, the risk matrix, whether it's the severity is high or whether the severity is low, whether the probability is high, whether the probability is low. And when you have that, you can determine whether it's a high risk, a medium risk, or a low risk. Now, with the likelihood, we can consider two types of likelihood. One is the probability that the person exposed to the virus can become ill, or whether there is a probability of the person ever being exposed to the virus. An employee in isolation working from home is less likely to be exposed to the virus due to their working conditions, whilst an employee traveling in public transport has a higher probability of being exposed to the virus. And then, of course, the severity with this can range from illness all the way up to death. Okay. Controls, and then the Department of Employment and Labor's instructions. So the controls have a 5-tier practice where you try to first eliminate it, and your last control is PPE. So this has also been shared with everyone via the email on the different levels of control. So elimination, that's our primary focus, is to eliminate the risk and the hazard by isolating people, keeping them at home, working remotely, virtual meetings instead of face-to-face meetings. Substitutions are currently not applicable to address the risk of exposure. Engineering controls include screens, barriers, face shields. It includes non-touch refuse bins or foot-pumped hand sanitizing units. It includes something keeping the door open or foot-operated handles. There are various control measures that's already been put in place, and there's various companies involved in this, trying to find different measures to keep people safe. Administrative controls include scheduled work, shift work, flexi time, reduced number of employees, and we'll get into that one a little bit in the next slide, especially regarding the 30%, 50% rules that has come into place. And then disciplinary practices is very important. If an employee is breaching the principles and protocols in place, action must be taken. PPE has become compulsory. All persons must wear face masks, specifically cloth masks, and this must be supplied, and I'll expand on that as well in the next slide. And then also consider the different types of PPE for the different exposures. So an employee, a cleaner, is differently exposed to the virus than somebody who is working in an isolated booth with no interaction. So once your cleaners are allowed to get to work, say in level 3 or later on even level 2, you will have to take additional precautions specifically to them. So control measures, I have tried to summarize the list of controls that is stipulated within the directive. So firstly, someone must be appointed to supervise the implementation of the safety measures and controls. And this appointment will be in terms of Section 8.2 of the Occupational Health and Safety Act supervision, where that person will be specifically appointed to supervise health and safety measures for COVID. Symptom screening must be done and verified. This may be done through the use of a thermometer, completing a questionnaire or declaration, and verifying whether the employee is showing any symptoms that might be linked to the COVID-19 virus. Employees displaying any symptoms may not come to work, okay? They should take sick leave as per the basic conditions of employment. This is reiterated in Section 16.4 of the directive. So if anybody has any symptoms, they do not come to work. If they think that the symptoms are not related to COVID, they need to go to the doctor to be verified that it's just the cold or flu. Then social distancing measures must include the following: having employees work from home instead at the office. If that is a possibility, rather keep people at home. Also to take into consideration is some of these employees' children are not going back to school. So what are they doing with their children? And how are you going to accommodate this? Minimizing the number of employees at work. Here with reference to the Disaster Management Act, Table 1, talking about the different industries. Now, the different industries have different rates of how many employees may come back to work. For instance, if you are a coal supplier to Eskom, depending on the type of mine you are working in, some mines may be at full capacity. If you are in the retail industry, you have to start at 25% before you're allowed to move up to 30%, and then you have to wait before you can increase that as well. There's different ratios. So some industries have 30% rules, others have 50% rules, others have 25% rules. So you'll have to work through it depending on what industry you're in, and therefore then determine how many employees you're allowed to bring to your premises. So this is amount of employees per company premises, not company staff turnover. Then other social distancing measures include rearranging the workplace to ensure limited interaction. If you cannot rearrange the workplace, you must install either barriers or shields between the employees to ensure that they do not have direct interaction with one another whilst they're working. Where employees are exposed to the public, suppliers, clients, and customers must implement the following measures. There must be a distance between the employee and the public of 1.5 meters. You must install and use shields, barriers, or face shields even. Conduct symptom screening, display signage, and clients, public, and suppliers must wear masks. No one may enter your premises without a mask. All people in the public or at work must wear cloth masks. Employers must supply their employees with at least 2 cloth masks and provide facilities to those who cannot wash them at home to wash them at the premises. Also, you need to consider the condition of the mask. As people wear them, they will be damaged and worn, and they need to be replaced. Some will have their mask for a while, whilst others, due to the type of work they're doing, sweat, dirty work, they might need to replace them more often. You also need to train your employees on PPE. Sanitizers must at least have 70% alcohol, and this must be available in common areas, areas where people are interacting with one another, within vehicles where people are traveling together, and workstations. Work surfaces, common areas, kitchens, bathrooms, etc., all must be cleaned. Electrical appliances must be sanitized, equipment and other surfaces. And only paper towels may be used. You must consider the different means of transport and train your employees using public transport, especially your employees coming from rural areas with limited restrictions. We wish that the community wants to, the transport community want to adhere to the legislation. However, that we don't count on that. So do make sure that you try and help and educate your staff on how to use the public transport safely. We will also discuss practices for exposed employees at the end of this presentation. Then training and information. Sorry about that. SAR will support clients with various sources to help with training and reduce the pressure to find the correct and true information. There will also be COVID-19 specific toolbox talks every Wednesday at 8 o'clock as of 6th of May. So please let me know if you're interested in that. Contents of the directive must be shared with employees as per section 16.3 of the directive. The directive will also be shared with you guys when I share all of the presentation material. And employees must be trained before commencing of work on the applicable control measures, safe practices, and PPE. So when they get to work Monday, the 4th of May, you don't just jump in and start the machines. You will have to work through the training with your employees first. In things to think about, we're talking about training your first aiders on how to help others who might be exposed to the virus and the measures that need to take. Encouraging employees to report any issues immediately, any symptoms immediately, so that the necessary steps can be taken to keep them safe. Make sure that the hand sanitizer is available in the first aid kit, as well as surgical masks and proper gloves, so that the first aider and the person who's injured can be treated with as much caution as possible. Train the employees on hygiene practices, not just for work, but also for home. At work, there's so much things reminding them, and then they get home, they hug their kids as if nothing happened. The moment an employee gets home, they need to strip down, get their clothes in the washing machine and into the shower before they interact with anyone, and encourage people to obey the rules. If you don't obey the rules, this becomes a criminal offense, and you can be imprisoned for breaking the rules, not just of health and safety, but of the Disaster Management Act. And then finally, reporting of work-related COVID incidents. So if you display symptoms at the workplace, it must be reported to your safety rep or line manager immediately, or your HR. Make sure the employees know who they need to report to. Isolate the employee immediately if symptoms are reported during working hours, and identify employees, clients, and others who might have interacted with this employee. It's also important that when you identify those employees, they also end up being quarantined or isolated from the others. Complete the questionnaire as provided by the Compensation of Occupational Injuries and Diseases Act, specifically relating to COVID-19. And report the case of the COVID-19 hotline. Whether it is a suspected case or an actual case, it must be reported immediately. And then establish the next steps as identified in your COVID-19 policy. These steps might be that the person is sent home for self-quarantine or isolation, or that they send for tests, or that they just speak to the GP to determine whether it's actually necessary for them to go for the necessary testing. Okay, so I want to encourage as much self-discipline during this time to ensure that we all can stay safe and healthy without risk. Thank you very much for attending this presentation. I hope that I was able to at least give some answers and clarity on the questions out there. And as mentioned, the additional questions that you can put to me in email directly will be addressed in a Q&A letter along with the presentation that will be shared.